Hi, everybody. Welcome to Mastering Your Fertility TV. I'm Kristen Cornett.
And I'm Dr. Haley Nye.
And this week we are sharing with you episode 25 of our podcast. We had an amazing interview this episode with Amy Beckley. She is an infertility warrior, a miscarriage survivor, and a scientist with a PhD in pharmacology. And she combined her personal experience with infertility with her background in pharmacology to create a rapid response at-home urine progesterone test called Proov, Proov. So this is a really cool test that gives women the opportunity to test their progesterone levels throughout the luteal phase, or the second half of their menstrual cycle, to find out whether they're producing enough to support healthy conception, sustain a pregnancy in those very important early stages, and then also just confirm ovulation. So there are essentially 3 different ways to use this test, and it's a really cool resource for women. So we wanted to bring Amy on to share this with you and also talk about her personal story. And then throughout the episode, we're also going to be talking a lot about progesterone, because this is obviously really important to your fertility and to pregnancy. So we're going to be talking about why progesterone is so important to getting and staying pregnant. We'll talk about why it's actually not as simple as you might think to figure out whether or not you have low progesterone. You might think that you can just go to the doctor and get a 7-day post-ovulation blood test, and if it comes back fine, you're good to go, but it's a little more complicated than that. So we're going to talk about that. We'll also talk about some of the causes of low progesterone and what you can do about some of those things. And then we'll give you a deep dive into how the Proov test strips work and help you figure out whether or not this is something that can help you on your fertility journey.
All right, so I'm going to talk a little bit about progesterone, just giving you a little bit of background before you jump into this interview so you have something to base it on. So with progesterone, it is called progesterone because it's pro-gestation. It's the hormone that you absolutely need to sustain a pregnancy. So to just give you a quick little overview of your menstrual cycle, your first half of your cycle, you're going to have an increase in estrogen. And then you're going to have a spike, which is your LH surge, which is going to signal your body to release an egg into your fallopian tube. And then progesterone is starting to be produced based off of the follicle that turned into the corpus luteum or on your ovary. And so that's what's going to be creating that progesterone. And oftentimes in women, in fact, 1 out of 10 women have a hard time producing enough progesterone to sustain a pregnancy. And part of the reason why is because actually there's a really good analogy that I remember with estrogen and progesterone is estrogen is going to build kind of the foundation of the city, right? And so it's going to build like the roads and the foundations of houses, and that's going to be in your uterus where the estrogen is creating that nice environment in the lining of your uterus. And then progesterone comes in and creates the actual like buildings, the houses.
All the flair.
Yeah, all the flair. And it actually maintains it and it makes it beautiful and warm. And it's like a warm comforter that the egg comes in and lies in and snuggles up in.
That's a whole other analogy.
Exactly. I kind of switched analogies, but it's still part of the, the home and the comforter, and that's where you sleep. Anyway, so that's why progesterone is so important. And what happens is that if you don't have a really robust follicle and that follicle turns into a corpus luteum, it oftentimes can't make enough progesterone. And if it does, it will make enough to about 7 days. And so that's what Kristen was saying, is you go into the doctor and we take progesterone and it's like, oh yeah, you're good to go. No problem with progesterone. But then right after it just starts, dropping. And one of the signs of that is actually spotting before your period. So light spotting before you actually have like a full-on period where you have to use like a tampon or a pad or a cup. And that's one of the biggest signs. And then another big sign of having low progesterone is just a short luteal phase. And so if you're tracking your cycles and your OPK kit says that you're ovulating maybe day 16 or day 18 or something like that, but your period is only 28 days long, or your cycle, is only 28 days long or 30 days long, and you find that your luteal phase is like only 10 days, then that's a telltale sign that you have low progesterone. So anyway, we are going to take a deep dive into this with Amy on the podcast on this interview. And before we get started, we actually want to tell you about our free quiz that you can take. And you can find the link to that at our website at tinyfeet.co/podcast. And click on Amy Beckley's podcast episode. And that's, what episode is this?
25.
25, thank you. And so 25, and you're going to find the link to that quiz in, and what it is actually going to have a list of symptoms broken up into 5 different categories. And part of those symptoms is hormone imbalances. And so if you're wondering like, well, I don't know if I have a progesterone issue, or maybe mine's like an estrogen issue, well, you can go in and click those particular symptoms that you might have, and it will tell you if you're actually having hormonal imbalances. And then we also give you steps to be able to start addressing those hormonal imbalances. So go to tinyfeet.co/podcast, episode 25, and you'll be able to see that quiz there and get started right away. Enjoy the interview.
All right, welcome, Amy. Thank you so much for being here with us today. We really appreciate you taking the time.
Thanks for having me.
Absolutely. So you have a really personal story behind why you started your company. So why don't you start off by telling us a little bit about your background and why you got started in this work?
Yeah, so I have a background in hormone signaling. I went to school, got a PhD in pharmacology, and I started doing breast cancer signaling. So how a breast cancer cell becomes metastatic and metastasizes to the lung. And then from there, I did stress signaling. And so kind of how cortisol affects all the other hormones in the body, including the reproductive system. And then, I finished school, started a postdoc, basically getting our careers going, and decided, okay, it's time to start a family. And so my husband and I, tried, and then we tried, and then we tried, and it just didn't come easy to us. And we basically were told that our only option was to do IVF. And because I was getting close to 30 and I didn't want to waste any more of my time, I was this well-educated woman, and they were basically telling me this was my only option. We did IVF, and it was not the best experience. I don't think I've ever heard anybody that was like, oh, I love doing IVF.
I don't think so.
I mean, it's just, a lot of injections, a lot of appointments, a lot of missed work, a lot of costs, your hormones, it's stressful in a marriage. But we did 2 cycles and we had my son, and he's now 8. And from that experience, I was like, okay, I want to have another child, but I don't want to do IVF again. And so basically what I did, I was like, I'm a scientist. I've been studying hormones for the past 12 years. Is there anything I can learn from this? And so I really, kind of looked at my own cycle, did all the charting. I did the temperature, the mucus, just really trying to understand my cycle. And I went to the doctor and I said, I just think I don't make enough progesterone. I feel like, I'm ovulating, I'm getting the temperature spike, but then it's just dropping so quickly that maybe there's just not enough time for that fertilized egg to get through the fallopian tube down into the uterus and implant. And he says, well, there's not a very good diagnostic out there that tells you if this is true, but if it would make you feel better, adding progesterone after ovulation has never caused any harm to a pregnancy. It either will do nothing or it will help you. So I'm okay with giving you this prescription. So that's what I did. We tried naturally. I did, ovulation predictor kits. And then 3 days after the positive surge, I started on my progesterone. And probably the 2nd or 3rd month after that, I got pregnant. And I've been pregnant multiple times and I've always lost it, except for that IVF cycle. So I've had 7 losses in total.
Oh my goodness.
Wow.
But this time was different. I didn't lose it. I kept it. And now I have a daughter who's 5, and she's my progesterone miracle. And so, after that experience, I realized I didn't need IVF. I just needed different tools. And I wasn't alone. There was so many other women out there that were having the same issues, and they were faced with the same challenges. I was lucky enough that I could do IVF. We lived 20 minutes away from a really good clinic, had really good doctors. I had really good insurance, which I had a very flexible job. I could miss work. But a lot of people don't have that. And so it was really after it hit my family members. They also dealt with infertility, that I just woke up one day. My friend Christina calls me and she's like, Amy, we have to do something. Like, everybody's dealing with this. If we have a way that we can help women understand it, if it's a progesterone issue that's causing their infertility and not something that needs IVF, we can save those people some of that pain. And so that's why we did crowdfunding. Here we are. We're just scientists. We don't have venture capital. We've never, scaled businesses, anything like that. We just had this idea. We put it out there and we said, okay, if this is a viable product, if women want to purchase this product, they will, and they'll fund it, and we'll make it, and we'll do that. And that's what happened.
That's an amazing story.
Such a great story.
That's it's so inspiring, and it's so wonderful that you had the background that you had. And of course, I mean, it must have been devastating to go through what you went through, and, experiencing 7 losses like that, and not having the information brought to your attention. Like, it was such a, I guess, for lack of a better term, an easy fix. And yet you had to go through all of that. But I guess, the silver lining of that is that now you've created something that can help other women avoid that pain.
Yeah, absolutely. I feel like it was my journey to be had. And I went through those years of infertility, those losses, to come out with this product. Like, that's kind of what gets me through all of that, is to know that, I had to go through that to create this product. And, it doesn't make it better. No, it doesn't, every time I think about it, but it helps me say, okay, that's something that I had to go through, and I went through this for this purpose.
Yeah. I feel like that all the time about my journey, going through infertility and struggling with a lot of the health issues that I've struggled with, that seem to be a little bit more complex than a lot of what other people experience, having to do so much more work just to get a little bit of gain in your health or your fertility. And that's hard, but that is ultimately what led me to this work. And so I'm thankful for that in a weird way, in a silver lining sort of way.
Yeah.
Yeah.
Amy, could you tell us a little bit about the product? Like, what exactly does it, what is it?
Right.
What's this amazing product?
Well, so our product is called Proov. I don't know if you guys can see the shirt, but that's kind of our tagline.
Yes, Proov.
Oh, that's cute. I want one of those.
Yeah.
I'll send
And it
you
says,
one.
don't just
Okay.
predict ovulation, prove it.
Right.
That's great.
So what we are is we're a rapid response progesterone test. And so we look just like a pregnancy test, an ovulation test, but it measures progesterone, which is released after you ovulate. And so the idea is, you can, this is something you could do at home to measure your progesterone levels. You collect first morning urine, dip a strip, wait 5 minutes, read the results. And a positive readout means that you are ovulating and you're producing the minimal amount of progesterone typically needed to support a pregnancy. And so a lot of our consumers use this product for different reasons. And I mean, it's just a progesterone test. So a lot of women are, they're doing fertility awareness. They just want to know if they've ovulated. And so you can take a single test. If it's positive, you've ovulated. Your progesterone is over 5 nanograms per mil equivalent in the serum. And you can say you successfully have ovulated that cycle. And then we also have a lot of women that use it when they're trying to conceive, to look at their implantation window. So I had a condition what's called luteal phase defect. And so progesterone can follow many different patterns. The typical pattern is you ovulate, it goes up, it peaks at about 7 or 8 days, it stays up, and then it comes back down, and then that decreases, what causes your next period, the bleed of your next period. And so if you have a luteal phase defect, you either don't hit those thresholds of progesterone, so maybe you just have a smaller increase of progesterone and then it goes back down, or what you have is it falls too quickly, which was what my case was. So, typically when you go in for a blood draw at a physician's office, they do what's called a day 21 We all know that's not right. It's really 7 days after ovulation. And that's a single point in time where they say, okay, it's been 7 days since you've ovulated. That's when your progesterone's at its peak. You go in, you get it measured. Typically, they like to see numbers above 10, above 15 is spectacular. And, that's kind of the levels that they like to see. And I was getting those numbers. But the problem was on day 8, day 9, I would start spotting and I get my period. So I'd get that nice increase and then it would just crash. And so I didn't have enough time. So a lot of women use this to measure that implantation window. So progesterone should be elevated starting at about 5-6 days after your positive ovulation test, and should stay elevated until about 10 or 11 days after ovulation. And so, they test during that window to see if their progesterone is high and it's maintaining those high levels. And if not, it could indicate some problem. They can go talk to their doctor. And then the final big reason to test progesterone is something near and dear to my heart, which was miscarriage. We as women, we want to feel in control of our pregnancy. And there's a lot of things you can't control. The number one cause of pregnancy loss is, sperm and egg didn't get together, chromosomal, genetic things. Then that's nothing we can do to prevent that. But about 25-30% of pregnancy losses can actually be prevented. And one thing a woman can do is she can monitor her progesterone levels. So progesterone is needed for that embryo to implant in the uterus and to sustain that pregnancy for 9 months. So if some reason your body hormones are out of balance, you're not creating enough progesterone to nourish that embryo, that could lead to early pregnancy loss. So a lot of women will just take the test, peace of mind. They just want to know that they're doing everything they can to support that pregnancy. A lot of times we can't do anything, but if there's something that we know is going on and we can fix it, that empowers us to ask better questions to our physicians. It's all about, knowing, having more information and getting better answers. If I didn't know progesterone was an issue, my doctors didn't either. All the lab work indicated everything was fine. So like, oh, you have to do IVF. But if I had been empowered with this information, I would have been like, maybe it's just a progesterone issue. And I could have fed that information back to my physicians and we could have taken a different course of action.
Yeah, I think that's one of the difficulties with the way that we test right now is that typically when we're testing hormones, we're doing like a day 3 estradiol and FSH. And so we have a snapshot at that point in time. And then we do the same thing with progesterone 7 days after ovulation. You get this one snapshot, but it doesn't tell you anything about sort of the pattern of what your hormones are doing. And like you said, you were hitting those thresholds for progesterone, but then dropping off right after that. And of course, your blood test wouldn't have indicated that. So you would have been essentially a case of unexplained infertility. Were you actually diagnosed unexplained?
Yep. Those are the hated words. Yeah. Oh, yeah, you have unexplained infertility. Great.
Yeah, we hate those. We hate that diagnosis because it's just like, no, that just means that you haven't asked the right questions yet, or you haven't dug deep enough yet.
Well, and what I found in my practice is, first of all, asking a patient to come in twice in 2 or 3 weeks to do a blood draw, especially, most people don't like blood draws, and you're like, well, you're going to have to come on this day. And then like 2.5 weeks later, you got to come on a different day. I get to poke you again. And then like you were saying is that it is just a snapshot in time. And we were just, we interviewed Dr. Carrie Jones with the Dutch test, and we were talking about the difference with progesterone being, very fluctuate even during the daytime, right? So it fluctuates a lot. And so who knows when you're just doing the blood test, if you're catching it when it's a little bit lower or a little bit higher. And so it really is quite unpredictable. And so just like what happened in your case, I'm sure there's many times where I'm telling my patients too, your progesterone looks great. Let's look other places that might, be affecting your fertility, when in all reality, maybe 2 days later, their progesterone just tanked. And so even with the Dutch test that we like to do for hormone testing is not going to be as effective at all compared to your Proov strips, because that's going to be something where it's just 1 day's worth, right? So that's going to help with knowing like where the progesterone is, are you producing it? But as far as like amount, and are you suffering from like a luteal phase defect like you were, that's just something that we're not going to be able to know even with the Dutch test.
Yeah, I mean, Dutch is great because you get like a really cool snapshot of a bunch of different hormones, and you see the pathways, and you can see methylation activity and some neurotransmitter activity. In my particular case, the cortisol information was very relevant. And I want to ask you about cortisol in just a minute because I find it really interesting that you brought that up. But yeah, I mean, the Dutch test is great for a lot of things, but in terms of the monitoring ability, what's really happening throughout your luteal phase, it doesn't have the ability to do that unless I think they have a cycle mapping option, but it's, tends to be very expensive and it's a lot of peeing.
Yeah, sure is.
Throughout the whole test.
And it's expensive.
Yeah.
I wanted to ask you about, because I know there's probably a lot of women that are listening that are saying like, oh, well, I went to my fertility doctor or even my primary care doctor and they told me that progesterone doesn't matter. And I think that they're getting this information because of the recent studies that have come out, that they've done these big meta-analysis, right? And they say, oh, it doesn't matter, and so
it doesn't make a difference.
Yeah. And so I want you to talk about these studies. You wrote a blog article on it. And so we can link to that in our show notes, but go ahead and just tell us why that's not the case.
Yeah, right. So this is great. So they did this study. It's called the PROMISE study. It was in the UK where they did a huge number of women. And basically they concluded that progesterone supplementation does not help you have a more positive pregnancy outcome. And basically what they did is they took women and they had them, just go off and try to conceive. And as soon as they got a positive pregnancy test, they called up the study and said, hey, I got my positive pregnancy test. They were put into two groups. Either one was, I'm just going to follow you, or the second one was, let's put you on progesterone supplementation. And then they followed them and they actually found that there was no differences between these two groups. And then they concluded that adding progesterone does not help the survival of a pregnancy. But then there was another study that was done a couple of years before, it was a smaller study, but what they did was they actually took women that were trying to conceive and that were labeled as infertile, and they had unexplained infertility, and they divided them into two groups, and they said, okay, you track your ovulation, and then 3 days after ovulation, you either take progesterone or you don't take anything. And those were the two groups. And what they found between these two groups is the ones that were on progesterone supplementation right after ovulation had I can't remember the exact numbers, but I think it was like 33 or 36% increase.
Oh, it was huge. Yeah.
Yeah. So basically what that means to me as the scientist is that if you wait until you have a positive pregnancy test, it's too late.
It's too late, right?
There's no effect. And that's because progesterone's role is to get the uterus ready for that embryo. It makes your uterus receptive to that embryo and a good home for it. And so if you have a luteal phase defect and you don't have enough progesterone, you can maybe get implantation, but maybe it's not effective implantation. So it could either cause infertility or early pregnancy loss. And so by the time you get the positive pregnancy test, implantation has already happened. Right. And adding, somebody told me this metaphor, it's like throwing water into the ocean. It doesn't really matter at that point. What you need to do is you need to add progesterone when it really matters to get the uterus prepared. And so, all IVF treatments include giving progesterone, all of them. They now have this study, this test. It's called the ERA, E-R-A. I don't know if you guys have seen this yet. It's really cool. So if you have a patient that's doing IVF and they're getting failed implantation, it's because the timing's not right. And what they do is they do this genetic profile and to look at all these genes, and it's the receptors, it's all the things that progesterone increases. And so based on the results of failed implantation, they can say, okay, you haven't had progesterone in your system long enough, or it's been too long. And so they change your transfer date accordingly based off of if your urine receptibility to the embryo.
Wow.
Really
now that's science.
Really
yeah. That's really cool. Now I just wanted to talk about the type of progesterone that these women had in this particular study. So from what I read, they were either getting 100 milligrams or 200 milligrams twice a day, and it was micronized progesterone vaginally. So it was a suppository, right? And are you finding that that's like a common prescription for people, that if they are going to their doctors, that that's what they're given, or are they often given like oral progesterone? And is there a difference? What would you say you prefer?
Definitely the vaginal progesterones work the best. So progesterone is an oil soluble drug. So if you take it orally, it has to pass through the digestive system, and it gets degraded by the liver before it can actually reach your uterus and be effective. So, that's why you see, progesterone creams, you see sublingual, you see the vaginal. So it's another way to absorb it besides orally. That also brings up, you can get over-the-counter progesterones in these creams, and some people have had success on that. I feel like it's maybe if they have a slight imbalance, they can get a little bit of help. But if you're really feeling like you don't have very much progesterone, you're seeing these dramatic decreases, that, the vaginal types of progesterones work by far the best. And, to talk to your doctor before you go out and try to self-medicate over-the-counter things.
Yeah, I totally agree. Those over-the-counter usually have equivalent to about like 40 micrograms of progesterone in them. And so when you put them on their skin, I mean, obviously not all of that is going to be absorbed. And so it's just really not going to be quite as effective as, say, a 200 milligram dose that you're putting directly into your vagina. Yeah. And so there's ways that you can get like a compounded progesterone suppository, which is, I would think, is the most common. That's definitely the way I prescribe it, with very little fillers or no fillers at all, no preservatives, and it could be really safe and effective. And like you were saying in the beginning, is that it doesn't do any harm. So why not try if you're suspecting that somebody has a luteal phase defect, which I really like.
Right. Yeah, I was talking to somebody at one of these fancy New York clinics, and they're like, I don't understand why you would even test for progesterone, because all women are just put on progesterone as a precautionary measure. And I said, no, they're not.
Right.
At your fancy New York clinic, yes, because you know that is standard of care. Like, your women, when they come through the door and they're having trouble conceiving, you just give them progesterone, but that's not commonplace. Like, women, not all clinics do that. Not all women go to fertility clinic. They don't have access to it. And so they thought that was quite interesting, that wasn't standard of care.
Yeah, well, I mean, and it probably should be, but then, we run into the testing issue as well. Like, women who aren't in a position where they're going to be seeking out treatment at a fertility clinic, they go to their doctor, they get their hormones done. That's what the doctor knows, like, oh, the test came back fine, so it must not be progesterone. And so, of course, at that point, you wouldn't think to give what you believe to be an unnecessary medication to that person at that point.
Right. Yeah. I mean, it's all about empowering and letting women have that knowledge so they can ask better questions. And a lot of times, women don't need prescription level progesterone. They can do dietary changes. A lot of the things in like the fertility medications, the reason that they are not medication, supplements, like, I don't know, I can't even think of one right. Fertility.
HEA, CoQ10.
What they do is that they regulate your hormones, right? So that's how they're working, is by helping you balance those hormones and getting your cycle back to normal.
Yeah. So I'm curious. I'm glad that you brought that up. So I'm sure that you've done a lot of research on this topic about what can ultimately lead to low progesterone in the body. So what are some of the things that you know of that can maybe cause somebody to not produce enough progesterone? And please mention cortisol, because this is very relevant, I think, to a lot of women, especially those that are going through this journey, and having imbalanced cortisol is pretty common, I think.
Right. Yeah. So I believe 3-4 years ago or so, ACOG, the American College of Obstetrics and Gynecology, came out with this statement that they said the menstrual cycle is the 5th vital sign. And I thought that was really interesting, because it is absolutely true. And if you think about it, the menstrual cycle is like last in line. Like, your primary goal of your body is to stay alive. And you have to breathe, you have to get oxygen, you have to feed your tissues. And the last thing on the list for your body to do is to conceive a child. And so any time that you're stressed out, you have increased cortisol, if your body is not functioning, if you're out of homeostasis, basically your body steals resources from your menstrual cycle and takes them to feed other places. And so if your body is out of balance, your menstrual cycle suffers. And I feel like progesterone is the last hormone in the menstrual cycle. So it's an overall like functional readout of how balanced your life is. And if you have low progesterone, there's something else upstream that's going on. The biggest one that can impact it is stress, is cortisol. And there's several ways. So the first one is if you're under high stress and your body needs to make cortisol, it can actually use progesterone as a building block to make cortisol. So it steals progesterone to make cortisol. The next one is if you have too much circulating cortisol, it can bind the progesterone receptors on your uterus and prevent progesterone from binding, making your uterus non-receptive.
So even if you are producing enough, it can't actually hit the receptors because your cortisol is too high.
Right. Your cortisol is basically blocking it. And so it can't bind. And so, these women that have high levels of progesterone and not conceiving, they could very well just have too much cortisol. And that's what's keeping them from conceiving because their uterus is just not ready. Another is inflammation. So dietary. I've actually found that I'm lactose intolerant. And I've switched to oat milk, which is delicious, by the way. And so I've been doing some dietary changes and cutting out dairy, which reduces a lot of that inflammation in the gut, and doing seed cycling, which basically gives my body the right nutrients for what hormones are being produced at that part of the cycle. Pretty much supports my body's own hormone levels. And I found that very, very helpful. So, I think the biggest factors are stress and your diet.
Yeah. Totally agree. I mean, food sensitivities are such a huge trigger of inflammation. And this is definitely something I found to be true in my journey. I had horrific food sensitivities and I had no idea, until I started cutting a few things out of my diet, literally out of just desperation. Like there's so many things wrong with me. If it helps me to I'm horrifically gluten intolerant. And my husband came up with this idea after picking up a book at a family member's house. And he's like, hey, maybe this could help you. And I'm like, what do you mean? I was totally not bought in. I was so skeptical of the ability of a food to wreak that kind of havoc in your body. Like you could be so sensitive to something that could just throw off everything. And yet I found after eliminating it that, things started to really turn around. And then I really started to believe in the power of nutrition and then, eventually became a nutritionist and now do this. But this is exactly the reason that Dr. Haley and I do food sensitivity testing with our clients, because it's an important source of inflammation to consider. It affects gut health. It affects immune system health. That ultimately affects things like implantation, your body's ability to balance hormones, having too much cortisol, not enough progesterone. It's really interesting how much diet has an impact. And it's something that people kind of discount because it's like, we think of this fertility journey and all the things that we're talking about right now as really sciencey, and it requires treatment. And it's like, well, there may be some aspects of this that don't require treatment. This could really be as simple as diet and lifestyle for some people.
Yeah, absolutely. Absolutely.
So I know that we were probably mentioned in previous episodes about the luteal cells and that they take about a year. They start gearing up for ovulation about a year in advance, right? Mm-hmm. So those luteal cells are the ones that turn into the corpus luteum. So they help, ovulate the egg, and then their main job at that point going forward is to be the corpus luteum and secrete progesterone to support a pregnancy. Could you talk more on the luteal cells and maybe how we can support those cells specifically?
Yeah. So, your points are spot on. And I remember reading that comment on your Instagram. By the way, I love your Instagram content.
Thank you. We didn't pay her to say that, I promise.
No, we didn't. But it's things that you don't hear very often. sometimes you just hear the same thing over and over and over. And I commend you for picking up new topics and new things. So
thank you.
so yeah, when you ovulate, the follicle around that egg will turn into the corpus luteum, and that's what actually produces the progesterone. And one of the women on your feed made this comment, and she was like, well, if it takes a year, what do I do if I want to get pregnant now? Like, how do I fix that? And I've thought about that. And, one of those is basically, putting a Band-Aid on it, which would be giving supplemental progesterone. That's kind of like the Band-Aid. How do I fix the problem that's already happened? Coming to the root cause would be dietary changes, supplements, really trying to internally balance those. But as you've mentioned, it takes a while. And then there's also other fertility medications that, like Clomid or Femara or an HCG trigger, which actually induces a stronger ovulatory event. And so basically what that does is that helps those luteal phase function. I've also heard of mid-luteal HCG booster shots, which basically, for my particular problem, I had the luteal cells that were producing progesterone, and then they just died out too soon. And so if you give a mid-luteal phase additional injection of HCG, you basically rescue that corpus luteum so it continues to produce progesterone.
Interesting. So you're kind of tricking those luteal cells into thinking that, oh, we conceived, we're pregnant, we should probably keep working.
That's exactly what it is. It's exactly what it is. Is it sees HCG? So a corpus luteum's lifespan is about 12 to 14 days, and then it just stops unless it gets rescued by HCG, which is the pregnancy hormone. And so by giving them that mid-cycle, you're basically saying, oh, wait, don't go away. I'm going to rescue you, give you some HCG so you keep producing progesterone. It's a great theory. I've done both ways. I prefer the supplements over the additional trigger shot because you can't take a normal progesterone, or you can't take a normal pregnancy test when your period's supposed to happen because you still have HCG in your system.
It'll be false.
Yeah.
And so it's very mentally, like, it does the same thing, but it mentally was very hard for me because you had to go in for a blood test. And even if it was positive, you had to go in again to see if your numbers were going up or down. And so I did that one time and I'm like, nope, just give me the supplements.
Yeah. But I think that's important to understand that, okay, we can put a Band-Aid on it. We can definitely do things now to help with trying to conceive. But it can take up to a year if you're really treating the root cause, and to not get discouraged per se. And Kristen has a personal story with this as well.
It really can be discouraging. And so, I was about 2 years into my fertility journey when I was like, okay, this is clearly health related. This is clearly gut health related specifically, because I had so many issues with that. And it has been a long road to recovery. And, I've considered a couple of times, maybe we should try putting the Band-Aid on it. Like, do I want to conceive faster? I'm 30 years old. So, I'm kind of in a position where I feel like I still have a few years to get things figured out. And my husband and I are getting ready to conceive again. But, my thing is like, I really want to know that I've addressed the root cause of what's going on. I don't feel like I'm in panic mode, like I have to get pregnant right now or all my eggs are going to be gone. So, it is a difficult thing to balance between, like, yes, I want to start a family. And yes, I want my body to be in the best possible condition. And I want to address whatever the root cause is of low progesterone. So I have a personal story with using the Proov test strips, and I'm still not producing enough progesterone. And I think about what was going on in my life a year ago, and there were a lot of really stressful things happening. I was like in the middle of treatment for parasites. I was full of inflammation. My Hashimoto's was flaring. I was losing all my hair. And I'm like, I wonder if what's happening in my cycle right now has some to do with what was going on in my life a year ago, and how kind of poor my health was at the time as I was trying to go through this really intense treatment for multiple parasitic infections. So I'm kind of like trying to be patient because my cycle has gotten worse in the last couple of months, and it's freaking me out. It's like, oh, I'm going in the wrong direction, and things are getting worse. And so, I used the Proov strips, and I was like, well, I already knew, like based on what I was spotting in my cycle, that I wasn't producing enough progesterone. I didn't expect them to turn positive, but it was just like, darn,
Yeah.
we're not there yet.
Well, not only that, but we did a Dutch test, right, for you. And
Yeah,
that
a year ago.
Was that about a year ago?
It was in June of last year.
Well, and tell them about your cortisol.
Oh, yeah. So I'm one of those like crazy freaks that just produces so much cortisol. And actually, a lot of it from the Dutch test, they do like cortisol and cortisone. I think most of mine was actually cortisone. And I was also having trouble metabolizing it. So there was obviously some kind of a trigger that's causing me to overproduce cortisol. I actually found in my genetics that I have a predisposition to cortisol resistance as well.
Oh, which will spike up your cortisol.
Right. Yeah.
So cortisol resistance is basically her receptors are not responding to the cortisol. So her brain is saying, okay, let's produce more.
Mm-hmm.
It's like knocking on a door and nobody's answering. You're going to knock louder.
Right. So, there are a lot of things that are probably contributing to that cortisol response, or that have been contributing to that cortisol response in the past. I mean, owning a business is definitely one of them. But there are a lot of other things like persistent food sensitivities. And, we're running an MRT on me right now to figure out exactly what it is that's still causing a problem with diet, because you got to realize that when the gut is not, if the integrity of your gut lining is compromised, then you're going to start to become sensitive even to foods that aren't necessarily culprits for a typical food sensitivity. We're not talking about things like wheat or dairy or soy or corn or eggs. We're talking about like you could be sensitive to cabbage or kale or strawberries or, something that you wouldn't consider. And that's why the testing is really helpful to like try to uncover some of that stuff. So we're still working through some things with me, but I'm a really good example of how the dietary piece, the gut health, and the lifestyle have kind of all created this perfect storm that has made it difficult for me to produce enough progesterone to sustain or even achieve a pregnancy. So,
yeah, I think it's about options, and not all women are the same. They don't have the same journey. They don't have the same. Some want to be pregnant yesterday. Some want to be, oh, I'm just going to wait a year. They have their own timelines. And, there's different options for different people, right? I was, in my case, it was like, they wouldn't give me a treatment. I called them and said, let me come see you. You're the expert. You can help me get pregnant. And they said, no, because you haven't been trying long enough. And that for me was so frustrating. And it was like, I knew I had a problem and I had no idea to fix it. And so by the time I actually got in there, I was in desperation mode. And my doctors saw that. They're like, okay, let's do IVF. She's ready. And that it worked, thankfully. But, each person kind of comes in with their own timeline, their own thing. So I think it's important to know that you can kind of get at it at different ways. And it's not like this is the only way to do it. And some people, unfortunately are looking for the quick fix, put the Band-Aid on. I did that. It was successful. Now I'm on the other side. I still have progesterone issues, and now I'm doing the diet, and now I'm fixing it, and I feel incredible. Like I don't have headaches all the time. Like I don't get cramps or PMS or anything like that. Like my periods used to be so heavy, and now they're just, normal. I'm like, wait, you don't go through like a Super Plus tampon every hour? I was talking to my friends. They're like, no.
It's weird when things start to change and you're like, it's almost difficult to accept because you have certain things that you're just like used to happening in your cycle. And it's almost like a sign of like, yes, my period is here, or yes, this is normal for me. And it starts to change and it's a little disconcerting. Like if my period were to surprise me, I would be like, oh, well, how do I know I'm expecting it if I'm not in pain? Like, how do I know that this is really day one, that this is really when I'm starting? I don't know. It's a little surreal when things start to change. And it's also really cool, to recognize that some of the changes that you're making are having a positive impact. So that's good to hear.
Yeah. It's amazing.
So talk us through the use of the test strip. So what is, for the different reasons that you would be using these, kind of what's the process? How do we use them? Just give us the rundown.
Yeah, so we basically complement anything else that the woman is using to track their cycle. And so we monitor the second half of the cycle. So, whatever you're doing to monitor, predicting ovulation leading up to, if you're monitoring cervical mucus, if you're doing ovulation tests, any of those types of devices, we recommend that you start testing after. Well, first we recommend that you take what we call a baseline test. And that is going to be negative. That's going to be at the beginning of your cycle, like as soon as your period ends, day 7, 8, 9, somewhere in that range. Because we find if people see a negative test and then later in their cycle, they can see the changes, it helps them understand things better. So they take the baseline at the beginning as soon as, their period ends. And then, they do their fertility prediction. And as soon as they get the peak fertile mucus, as soon as they get the positive ovulation test, if they're doing temperature monitoring, the third temperature increase, those are the 3 things where we say, okay, now you can start measuring your progesterone. And so we have a yes/no answer. And so it takes about 4 or 5 days after ovulation for progesterone to produce enough, for your body to produce enough progesterone to hit that positive cutoff. And so, typically, the test 4 or 5 days after your LH surge, ovulation mucus, 3rd or 4th high temperature, that's when you're going to get the positive progesterone test from the Proov strip. And then it should stay positive until about 10 days after ovulation. And then if you did conceive that cycle, it will remain positive. And if you did not conceive, it'll go back down to negative. And we do have some women that use it to predict when their period's going to come. So it'll get positive, and it'll start going back down. They're like, okay, in the next couple days, I'll have my period.
Yeah. So, I mean, you're basically just collecting like a small amount of first morning urine, and it's just like a little dip test basically. And then you set it flat. Reading it is just a little bit different though, because we typically look for a line to show up when we're doing like a pregnancy test or a dip strip for an ovulation test. This is a little different. The line disappears when it's positive.
Yes.
Okay.
Yeah. So you collect first morning urine in some kind of container, clean container, dip a strip 5 seconds and then lay it flat. And then after 5 minutes, you read the number of lines. So you'll always see the control line. And if not, it's an invalid test. Your baseline test will have 2 lines. So that will be a negative result. It doesn't matter if the line is, as dark as a control or a little bit less. That's why it's important to do kind of a baseline to see what that looks like. And then when your progesterone gets elevated, that test line will fade, and then it will finally disappear. And, women, I've done this I do this a lot. It will stare at pregnancy tests, like looking at it sideways, around the corner, to see this little faint little whisper of a line that you can't do with our test because it's a different technology. And so to get around these women that are seeing these like faint little whispers of lines, we tell them, take your test, take a picture of it, look at the picture. Do you see another line in that picture? And if not, it's a positive test.
I think we call those line eyes.
Yes.
It's really, really I totally remember doing this at the beginning of my journey. I cannot even imagine how much money I spent on ovulation tests, on pregnancy tests. My hormones were so messed up after I got off birth control and we started trying to conceive. And I can totally attest to that. I like this test because it's a little bit more difficult to have line eyes, So
yeah, then that's exactly why we do the baseline, is so that women can understand what a negative test looks like.
Yeah,
that's great. So when it is positive, then you said that positive amount is equal to a serum amount, right? And what is that serum amount? Is it 10 nanograms per milliliter?
It varies depending on women, because again, progesterone is cyclically produced and is secreted into the bloodstream. And so it depends on if you're on a high or a low, but it's anywhere between 8 and 10 nanograms per mil is when the test is positive. And so 5 is typically ovulatory. So if you get a single serum level of 5 nanograms per mil or above, that's indicative of an ovulatory event. But 10 is really the lowest amount of progesterone that physicians, medical professionals want to see in a healthy pregnancy. And so our threshold is about 8 to 10. And that's so that if they're not getting that positive, they're below that threshold.
Okay, so this test is really for understanding what your progesterone is doing over the course of your luteal phase, right? So it's not just kind of used very well if you're just doing it on one day. I mean, it is, you can use it to know if you ovulate, right? But we're going to, the idea is that you would use it through day 4 or 5 after you ovulate through day 10, 11 until it starts dropping down.
Right.
And this is really useful information to be able to bring to your doctor. So, I mean, in addition to just knowing more about what's going on in your body, you can take this information to your doctor and be like, here's what I think is really going on. Kind of like what you did, you started paying attention to your cycle, and you could go into your doctor and say, hey, I think I need progesterone, something that's safe, that's not going to cause you any harm and could only do benefit. And it gives them a little bit of extra, like, yes, this is necessary for somebody. So, I mean, is that how you recommend using it? Just if you're not seeing a positive, they go to their healthcare professional and they do additional testing or figure out what's really going on there. And then if it is positive, I mean, I guess how does this kind of work in conjunction with the woman's physician? Like, how does this play into the whole process of figuring out what's really happening?
Yeah. So we're not here to replace medical advice or physicians or any healthcare provider. We're here to help the consumer, the woman, ask better questions to her physician. And so, she can take this information. So if she's never getting positive results, she could take this information to her fertility nutritionist. She could take it to her fertility specialist, her OBGYN, and say, here's this information. I don't think I'm ovulating properly. And then they can advise her, okay, maybe you need this supplement, you need this dietary change, you need this, whatever that course of action is. On the flip side, say she is getting positive results and she's ovulating. That's not the only cause of infertility. Another big one is sperm, right? So yeah. A lot of infertility is a male factor. And so, that's just one kind of box she can check, and she can go, okay, we're having intercourse in our fertile window, check. We are ovulating properly, check. There's home sperm test kits that are available. She can check that off too. And then she can bring this list to the physician and say, hey, I'm not conceiving. It's been a year. These are the things I've done. Use this information to help guide me. There's a lot of things we can't do at home, like check if our tubes are open.
Right.
There's structural abnormalities in our uterus.
Yeah, I love that this is something that empowers women to collect more information about their own body and be a participant in their care with their physicians and other people on their healthcare team. We're kind of all about that here. That's the whole fertility assessment idea. I mean, that's why we created that, is to basically give you as much information as you could possibly have so that you could take everything that you could take into your own hands, that you would have the tools to do that. And I think that this is just another fantastic tool that helps women do that.
Yeah, right? Absolutely. It's about empowerment. I mean, when I was going through it in 2008-9, I was just shocked at the lack of resources that were available to me. And, it was like fertility treatments, fertility care was like this carrot, like hanging over my head, and I could do nothing about it. I didn't have access. I didn't have the information, even if I wanted to have the information. And so for me, it's all about, what can I do? What can, if I need to wait a year to go get IVF, what can I be doing in that year? Maybe I don't need IVF. I just want options. I want information. I want to know that I'm doing something and I'm not just spinning my wheels.
Yeah. So what's the reception been like for Proov? How long has this been out, by the way?
So I told you we launched this product with crowdfunding.
Right.
And so we got the money to develop the product in 2016. We spent the rest of 2016 clinically validating the product. We launched in 2017, and we used every single penny we had to make more product. So as soon as we sold it, we made more. As soon as we sold it, we made more. We didn't do any marketing, any branding. We sold on Amazon in plastic bags. And the only way you knew about our test is if somebody else used it or you happened to find it online. And we kind of went through that for about a year. And it was basically the stories that I was getting from people online, emails I was getting: you're saving my marriage, you helped me identify an issue, I have PCOS, this is the first time I've ever been able to confirm ovulation, you finally convinced my doctor to give me the medication that I needed, like, you know, all of these things. And at that point, that was the end of 2017, I decided that we needed to really scale this. And so we changed the name from Ovulation Double Check in a plastic bag to now Proov. So it looks better. We kind of redid a lot of the chemistry to make sure that it was really accurate. And we're increasing our marketing and trying to actually let people know this product exists and all the functions and features.
Yeah.
You know, and you know, if we sell on Amazon. The number one reason is because there's so many products out there that I felt it was very, very important to have an unbiased way for people to review my product. I don't like it when I go to a website and I have my own, everyone has their own reviews on their website and it's all like 5-star. And I'm like, this isn't real. I wanted a real product for real women. Our product doesn't work for everybody. I mean, we have maybe 5%, 7% of women that they just don't metabolize progesterone efficiently, and they never get a positive result. And so, you know, I want to be upfront and honest and say, this is our product. It will help you. It'll help you answer questions. And you know, there's this public forum of reviews of people that have used the product. What do they use it for? You know, and then on the flip side, we do have women that have used the product and, you know, they're like, this is one of my favorite ones is, I had a clear temperature shift, but you still show me negative results. I've been trying to conceive for 2 years. And I'm like, maybe you actually have low progesterone. They think it's my product that's wrong and
Right.
not
Interesting.
and not their bodies.
Yeah. Well, I mean, that just kind of goes back to like really asking the right questions and, you know, taking this data as another contributor to figuring out what's really going on. I think it's difficult when you're in that position where you're already frustrated, you've been at it for a long time, and you get information that essentially tells you pretty clearly that you have an issue. That's hard to deal with. And I think maybe some people take that out in reviews.
Yeah, and the other thing is we always get compared to ovulation predictor kits. And people are just, why are you so expensive? Your product is $40 for 7 test strips when I could buy a box of 100 for $15 on Amazon. And it's because that's not the right thing to compare it to. Like, we don't help you understand when your fertile window is, when to have intercourse. We tell you if you're ovulating or not. To get the same information, you have to go to a physician, you have to pay your copay, you have to get a lab draw, you have to miss work. Well, that's the real kind of comparison. And so, you know, that's a huge complaint that we get is, why are we so expensive?
Well, and yeah, I think that's exactly the point that you just made, is that you have to compare it to the right thing. And if you are comparing it to having to go to a physician and pay your copay and take time off of work or whatever to go to an appointment to get that same information, but not get as much information from that single point in time blood test, I don't consider this product expensive. Maybe that's just me.
Important to know that ovulatory predictor kits are measuring LH surges, and they're measuring if you might ovulate because you had a surge. Proov is measuring a metabolite of progesterone. It's completely different. Yeah. And, you know, so it's just used completely differently. Just like you were saying in the beginning of the interview, is you're measuring the second half of the cycle. LH is part of the first half of the cycle. At the very end of the cycle, actually it's just mid-cycle, right when you're about to ovulate. So I think it's confusing for women, especially if they don't understand their hormones. and what's involved in the fluctuations and what's measuring what. I mean, it's confusing.
Yeah, I think it is a little confusing, but I'm glad that we're talking about this, that we're clearing it up, because, to get equivalent information from your doctor and still only get that one snapshot on a blood test would cost you at least as much money as buying the test strips and getting more information and having a better map of what's really happening in your luteal phase. So
yeah, well, as a doctor in my clinic, I find it's extremely affordable. In fact, I will be recommending it to my patients instead of doing blood draws, because it gives me a bunch more information, like we've just talked about, and it's less expensive, and I don't have to poke them with a needle. All very positive things.
Yeah.
So, yeah.
Yeah, and just to be able to do it in their home, if they could send you an email and let you know what's going on that cycle, to like make tweaks instead of having to come into the office for an appointment. So.
Right.
Yeah. So there are like kits where you can kind of prick your own finger and send it into a lab for like a not like a Dutch, that's urine, but other ones like Everywell and stuff like that, where you prick your finger. And I did one of those just, to compare it. And I was shocked at the amount of information that was needed to get my result. They're like, how many times have you been pregnant? How long have you been trying to conceive? How many kids do you have? What's your age? What's your weight? Like, and I had to fill them in to get my results. And I'm like, I would much rather go into my bathroom under my own privacy and do this. And if I want to share it with somebody, great, I share it. And if not, that's my business.
Well, and finger pricking multiple days in a row to get that information, as opposed to just like,
well, and I'm sure the
cup.
turnaround time is 2 to 3 days, maybe even a week. Like you really don't understand or get the results until it's way past where it even matters anyway.
Yeah, I mean, we're the only 5-minute to result out there. Unless you're going to fertility clinic that has it in-house and can do it in a couple of hours.
Right.
And then that for us is really, really important, because if you had to wait 5-7 days for your results, it's too late that cycle. You gotta wait till next cycle. How do you know it's not going to be bad that cycle? I don't know. So
right.
Yeah. So anything else you want to share about Proov? Any like specific advice that you have out there for women that are kind of on this journey? I mean, you have so much personal experience yourself. Any pearls of wisdom you want to share before we wrap up?
Yeah. So I always like to end with the same information: is you have to follow your gut, your heart. If there's something that you feel is not right, you need to speak to your medical care professional. And you need to have that person listen to your concerns. And if not, you need to find somebody else, because it's all about a journey and having a circle of allies around you, people that will support you. And if you're not getting supported by the person that should be the most supportive of you and your journey, you should consider finding somebody else. Because, I call it, woman's intuition, mother's intuition, whatever you want to call it. And that's what led me here. Is I was like, I think it's just progesterone. I didn't know for sure. But that's what it pointed at. And my doctor flat out said, don't think it's going to help, but it's not going to harm, but here you go. And he was supportive. He listened to me. He was like, okay. And it worked. And so
yeah,
my advice.
That's great advice. Listening to your body and what those signs are telling you. And if you have a concern or something you want to discuss with your healthcare provider, they should take it seriously and listen to you and validate that concern. And if they really don't believe it's an issue, they can have a conversation with you and provide their side of the argument or evidence to support why they don't think that that's relevant to you. But ultimately, I mean, you have the right as the woman to choose who cares for you. And if you don't feel supported by one care provider, you should find another. So I think that's great advice.
Yeah, I totally agree.
Well, thank you, Amy, so much for joining us today. This was extremely informative and I think very helpful to a lot of our listeners and very empowering for sure. So we appreciate you being here, and we will be linking to Proov and the blog post about progesterone and anything else you'd like to share with listeners in the show notes. And we thank you again for joining us.
Yes, thank you so much. I really enjoyed the interview.
Thanks for having me.
Yeah.
Hey, welcome back. What'd you think of Amy's episode?
That was such a great episode. I love this topic, and I think it's one that probably isn't getting enough play. So I'm glad that we had the opportunity to talk about progesterone, and we hope that you guys are interested and thinking about trying Proov. As you heard on the episode, I have tried this before and gotten some useful information. This is something that you're going to be recommending to patients as well, just because it's such a great way to be able to test without having to go into the doctor's office, and you can get kind of the idea of what your progesterone is doing throughout that luteal phase, which, as you now know, is really important.
Exactly. Yes. And just a reminder, if you're wondering if you have any hormonal imbalances or anything else that you feel might be happening that is preventing you from conceiving or having that baby that you want, then you can go to our website at tinyfeet.co/podcast. Click on episode 25 and download the Are You Healthy Enough to Get Pregnant quiz and get started right away with understanding where you can focus on healing your body and preparing for pregnancy.
And that quiz actually, in addition to helping you identify whether or not hormone imbalance specifically is something that's an issue for you, it's also going to help you identify some of the other things that we talked about that can contribute to hormonal imbalances. So it's going to help you identify basically whether or not you're healthy enough, whether or not your body is in good enough shape to be able to produce that very critical progesterone for you, balance your hormones, and help you have that baby that you've been hoping for.
Exactly. And follow us over on Instagram at tinyfeet.co. We would love to hear from you and interact with you over there. We are always on there every day, so you can find us there.
All right. We'll see you next week.
Bye.